Good morning. My name is Sean Hervey Jumper, and we'll spend the next several minutes discussing low-grade gliomas, particularly diffuse astrocytomas and oligodendrogliomas. So the classification of diffuse gliomas has changed dramatically over the past decade, and this has really been driven by large-scale genetic analysis that have identified molecular alterations that allowed tumor subtyping because of its prognostic significance. And this is proven beneficial when comparing conventional histology alone to molecularly subclassified and defined clinical tumor entities. So while diffuse low-grade gliomas can be histologically classified as either diffuse astrocytomas or oligodendrogliomas, these genetic analyses have revealed that diffuse low-grade gliomas can be further classified into one of several molecular distinct diagnostic entities, which we'll outline 4 specific examples using the figure that you see here. So we'll begin with diffuse astrocytomas, IDH mutant, WHO grade 2 tumors. So the integrated diagnosis of diffuse astrocytomas, IDH mutant tumors are WHO grade 2 tumors with an entity, an entity that is genetically defined by the presence of either missense mutations at the IDH1 R132 or IDH2 R172 locations. And these are often in combination in over 90% of cases with inactivating mutations or deletions of the TP53 tumor suppressor gene. In adults, this combination of IDH1 and 2 combined, or IDH1 or 2 and a TP53 mutation is accompanied by inactivating mutations or deletions of the ATRX tumor suppressor gene in the vast majority of cases. These tumors, however, lack a TERT promoter mutation or chromosomes 1 and 2, chromosomes 1p19q whole arm co-deletions, or any mutations in the CIC or FUBP1 genes, because these tumors and these characteristics are important for oligodendroglioma tumors. So that moves us to the next tumor entity. These are oligodendrogliomas, IDH mutant, and 1p19q co-deleted WHO grade 2 grade tumors. So the integrated diagnosis of oligodendrogliomas, IDH mutant, and 1p19q co-deleted is a WHO grade 2 tumor entity that's genetically defined by the presence of either IDH1 R132 or IDH2 R172 missense mutations in combination with whole arm co-deletions of chromosomes 1p and 19q. Again, in adults, this combination of IDH1 and 2 mutations and 1p19q co-deletions is accompanied by a hotspot mutation in the promoter region of the TERT gene. Additionally, recurrent mutations that are present in a subset of IDH mutant and 1p19q co-deleted tumors involve genes within the PI3 kinase signaling pathway, the CIC tumor suppressor gene, the FUBP1 tumor suppressor gene, the Notch tumor suppressor gene, and the TCF12 gene. Next, we'll move to diffuse astrocytic gliomas, IDH wild type with molecular features of glioblastoma. So diffuse astrocytic gliomas with low-grade histologic features, most often in the cerebral hemisphere of older individuals, have proven to be IDH wild type by sequencing. That are proven to be IDH wild type by sequencing, really harbor features more significant or more consistent with higher grade histology. So instead of harboring genetic alterations typical of IDH wild-type glioblastoma, specifically EGFR amplification, TERT promoter mutations, and the combination of trisomy 7 and monosomy 10, these tumors likely represent an evolving or undersampled glioblastoma. So multiple studies have now identified that such IDH wild-type diffuse astrocytic gliomas with low-grade histologic features but harboring molecular features of IDH wild-type glioblastomas are often follow a clinical course more typical of IDH wild-type glioblastomas than that of low-grade gliomas. So as a result, it's now recommended that such tumors be given the distinction of diffuse astrocytic gliomas, IDH wild-type with molecular features of glioblastoma, and given a WHO grade 4 assignment. Finally, the integrated diagnosis of diffuse midline glioma should be discussed as its separate clinical entity as well. So this final histologic distinction that we'll talk about this morning are diffuse midline gliomas, H3K27M mutant, which are WHO grade 4 classified clinical entities. Again, these are diffuse midline gliomas with the H3K27M mutation. These are tumors defined by their diffuse location within midline structures of the central nervous system, primarily thalamus, brainstem, cerebellum, or even the upper spinal cord. They harbor recurrent lysine to methionine missense mutations involving codon 27 in one of the histone H3 genes. So any diffuse midline glioma located within midline structures of the central nervous system harboring histone H3K27M mutations are assigned as WHO grade 4 entities, irrespective of having high-grade histological features.